Good evening. Thanks for joining today's webinar, Sheep Health, Vaccination, Pneumonia and Arthritis. My name's Ian McFarland and I'm one of the Sheep Connect SA team. Sheep Connect and the webinar wouldn't happen without support from the Australian Wool Innovation and the South Australian Sheep Industry Fund. And so for more information on Sheep Connect, please visit our website, follow us on Twitter and have a look at the videos on the YouTube channel. I'll hand over to our next speaker, Andrew. Andrew is a veterinarian with Livestock Logic based in southwest Victoria and mainly servicing sheep producers in southern New South Wales, Vic and South Australia. Andrew also runs a 4,000 composite and white Suffolk ewe flock and 400 cattle on a dryland and irrigation property south of Hamilton. So thanks, Andrew. I'll hand it over to you now.
Thanks a lot for the opportunity to talk to you guys tonight. So Ian's asked me to talk about pneumonia and arthritis, and essentially I'm going to talk about how pneumonia presents, the numerous ways it does, what the major causes are, and what can we do to reduce the incidence and severity. Happy to break for questions then, but if there's nothing, then we'll keep going. But I just thought while we're on the pneumonia topic, we can deal with those questions, and then exactly the same process with arthritis. So main causes and what they present, and the treatment and prevention options for arthritis. So pneumonia, I guess pneumonia does present in lots of different ways. And I guess I see the clinical picture, or what we're seeing more and more of is probably three things. There's increased reporting of lambs with pleurisy at abattoirs, which I suspect quite a few of you may have had that experience in abattoir feedback in the last few years. Also, we're seeing, this is probably the most worrying thing for us, I think, is we're seeing a real rise in mortality rates in lambs over the summer period, and that's really occurred in the last 5 years. And I feel like we've had this for a long time, but I think we're getting more and more of them, but increased reports of coughing in lamb flocks. And I made the point there at the end that we are getting these last two things, the mortality rates and the coughing. When someone rings me up and says, oh, I've got lambs dying, and they describe this syndrome, which I'll go into later, or they talk about coughing in their flock, I nearly always know that they're going to tell me they're running composite sheep, or sheep with a very heavy British bred influence. They're not things we see a lot of in merino flocks, and there's still a lot of merinos that are in our catchment. So I do see those two diseases as very much a British bred disease, and I do believe there's a genetic influence. That's just the clinical picture we're seeing, and someone will shoot me down on that later, but it's definitely by far and away they're the animals that are represented. And now, do you have a problem in your flock? Now, if you're not seeing any of the three things above, then don't be too concerned. I feel like there's a fair bit of chat about pneumonia at the moment, and I think it's probably in some ways being a little bit overstated, and I don't think you have to be super concerned about it affecting you. But if you are seeing some issues, then hopefully we can give you some tips on how to deal with that better, or reduce its problems. So first thing I want to make you aware of is there's a number of bacteria and viruses that are involved in this sort of respiratory complex. And for anyone that runs cattle, it's not unlike BVDV, pestivirus, and how that plays a role in the respiratory complex that we see in cattle. Sorry, when I say it's unlike that, it's similar to that. It's the mycoplasma over pneumonia is similar to the BVD in that sense. So for those of you who've got cattle, that might just help you realise that it plays a role, but it's not the only thing that causes respiratory disease in sheep. So the two sort of most common things we talk about are the parainfluenza 3 virus and the mycoplasma over pneumonia. So one's a virus, one's a bacteria. Now, they sort of cause a primary problem in an animal, which allows secondary bacteria, which Mannheimia hemolytica is the major one, to colonise the lung and cause significant disease in the sheep. That's as much in terms of the science I'm going to go into. And I really don't think it's that important at the moment what is causing the pneumonia in your flock. It's more about how we can minimise the susceptibility of our sheep. So there's three outcomes, as I see, with sheep that get pneumonia. There's acute pneumonia and death, which I'm sure when I describe it a little bit more, some of you will go, yep, seen that. There's the respiratory disease with reduced weight gain in the pleurisy that comes back in abattoir feedback. And then there's this minor coughing in a flock that's otherwise we perceive to be a very, very healthy flock of sheep. So I tried to find a really good photo of these sheep, and I actually didn't have one on record, so I had to grab something off online. But the acute pneumonia and death, I just want to describe this to people, because I do think it's really fascinating the way these animals present. But they're normal one day, and the following day they're isolated under a tree, droopy ears, and they die within 12 to 24 hours. And it really doesn't matter what you do. Once you see them with the droopy ears, they die. Often the head's hanging low. There's mucus coming out of the nose and sometimes the mouth. They might be struggling to breathe, but they're just really dull animals. This sheep shows it a little bit, but not as well as they normally are. And we get this. They die within 12, 24 hours. We do a post-mortem. I've got a pretty ugly photo here for you, but that's how they all look. Like that's the lungs. I'm just not sure if this is the lungs here, and that's all pus on the surface of the lungs. And what I can never get over is how these sheep have managed to live for as long as they have with such build-up of fluid in the lungs. It's actually pretty fascinating. And I guess the thing to know about sheep is like they're not athletes. They're walking around a paddock just eating grass. They don't need very good lung function to survive. So when they present struggling to breathe without any exercise, we know that they've got very little part of their lungs that's actually still functioning, which is I guess why we can never save these animals in my experience. The second sort of description of disease is the pleurisy. Now, the pleurisy is secondary to a lung infection, and I guess it's the permanent consequence of having an infection in our lungs. Now you can see in the photo there on the sort of right hand, and is my mouse? I presume my mouse is coming up, but you can see here that's sort of adhered to the wall. So that's what we call pleurisy, where the lungs we get the abscess or the pus, and we get fibrin, which is a scientific term, but that attaches to the wall and it never really lets go. So it's this severe infection in lambs, but they get over it. They're otherwise healthy, and they just have this sort of this adhesion to the lung wall, which when we kill them shows up. Now, I guess what we don't have a really good handle on in Australia is how much this affects weight gain. There's some reports from New Zealand that would say these lambs have got a 70 gram per day reduction in weight gain. But we see clients that are getting wonderful growth rates in their lambs, and they get this feedback from the abattoir. So I'm not convinced that that's always causing such a significant issue in lambs. And I guess I think the jury's out, and there's not actually really the work done in Australia to show what is the cost of having pleurisy in lambs. And I think it's sort of an area that we need to probably invest in to see how significant it is. So that's just a zoomed in photo of that same photo. Now, I just want to present 3 case studies to you, because this is the classic situation that we see. So I got a client, this is a couple of years ago, drafted his ewe lambs 2 ways, heavies and lights. The heavies were doing pretty well. He flicked them out onto dry standing feed. This is probably a little bit of an exaggeration of the photo here, but you can imagine in December for us, and it's probably equivalent to November for you guys, not on a loose and just on a dry standing feed. Lambs if they're not supplemented, they're going to lose weight very, very quickly. And that's what happened. He split them, heavies and tops. He ran both lots in. 6 weeks later, the light ewe lambs were looking wonderful. They'd hit their target weight gains. The heavy ewe lambs had all slipped. He thought they looked terrible. 10 days later, they start dying. He loses 10 over a couple of days. He treats them all with antibiotics, loses a few more over the next couple of days, but then they all come good with antibiotics. I guess the take-home message there is, if you don't feed sheep, they're highly susceptible to disease, and in this case, summer pneumonia is a classic scenario that pops up when we don't feed our lambs appropriately. And a client he was happy to put his hand up and go, "Yep, that's completely my fault. I've made these sheep susceptible to this disease." Another situation. So wet spring and infant feeding never happened to lambs before they were weaned. So they were weaned in sort of middle of December. A month later, they had high worm burdens. They were at a busy time of year, and they just delayed the drench for another week, which coincided with shearing. Lambs were shorn and went straight into a feedlot, and 200 lambs died within the first sort of 10 days of going into the feedlot. Again, all lambs received antibiotics and were all weighed at the time. They continued to lose more lambs in the sort of days post getting antibiotics. But 4 weeks later, when these lambs were weighed, they put on 330 grams a day. But yes, there was a 5% death rate in them. So again, we've stressed them with poor nutrition, terrible parasite management, shearing animals that were already extremely stressed, and I actually haven't put in there, but it coincided with a pretty bad weather event not long off shears. So I guess I'm pointing the finger at this another bad management situation where we've caused stress after stress after stress, and that's what's caused our summer pneumonia outbreak in these animals. But interestingly, once we got them on good feed and we gave them antibiotics to get them over the disease that they were facing, they actually did really, really well, which is why I struggle a little bit with this compromisation of weight gain in animals post being affected with pneumonia, and why I think it's really important we get some good data in Australia. Now, my third and final case study, and this is just my absolute, this has got everything in it, this one. This is the Bargain Hunter lamb finisher. So it's actually a good mate of mine from New South Wales that I grew up with, and he buys store lambs, and lamb prices were pretty, this is actually 3 years ago, I think this actually happened. But it's my favourite story to tell. So he bought 10% of the lambs offered in the Hamilton sale yards for the whole week. So they normally offer sort of 40 to 50,000. So he actually was actually trying to exactly remember the numbers this morning, and I actually think it might have been more like 8,000. But so he's bought these lambs. They've been delivered to New South Wales. So this is in late December. One thing about lambs that are often sold through the sale yards in Hamilton is they're very rarely ever been grade and trained. The intention of the sellers is to just sell them all the stores in December and sort of wipe their hands clean of them. Now, these lambs came from 30 different picks. So we've got lots of different animals being exposed to lots of different diseases. A smorgasbord of disease, really. It's our best estimate that most of these lambs were in 4 days off feed before they actually arrived on feed in New South Wales. When you consider time off feed before being trucked, before going to Hamilton sale yards, before being sold, before being transported to New South Wales. So, and then they're all shorn within 8 days. So all done prior to Christmas. So the stresses that we're putting under these sheep are amazing. And then we got a massive rain event up there over Christmas. So I'm putting it up here just to show you this has every stress you could actually cause to a sheep, except there wasn't a parasite burden that we know of in these, I reckon. So yeah, he lost 150 in 2 days. Post-mortem over the phone, we confirmed pneumonia, and he never told me how many lambs he lost, but we know it was sort of, I know it was pushing sort of close to 7 or 8% of those lambs within about a week's period. So why am I telling you about these? In my experience, most of summer pneumonia is caused by really poor management. Not necessarily really poor management, but it's a drop. We drop the ball on something, which causes significant weight loss in sheep, and then they succumb to the primary bacteria or virus that they've been exposed to. So what are they? The social stress, the sale yards, got nutritional stress, as I've discussed, shearing, weather, and I think it's the extreme fluctuations that often we might see in summer that's the big issue. In Hamilton, we can have a 40-degree day, and the next day we can follow it up with a 15-degree night, and that's a big change for animals. And worms are another one. So I think, I think we've got to take a lot of this on board and take responsibility for the fact that we're often not managing our sheep in the late spring, early summer period, and that's what's leading to a lot of these animals presenting with pneumonia, often 4 to 6 weeks into summer. So, yeah, are there issues in flocks that remove the stress where we still have subclinical disease? I reckon we need more work done in this area. It's my belief that when we actually manage our sheep really, really well, they perform really well, and while we might still see a little bit of coughing, their weight gains appear to be and measured are very good. So I think the jury's still out on whether animals in a otherwise healthy, stress-free situation are affected by some of these bacteria, and whether it does actually cause weight loss in them. An interesting finding has been that the amount of pleurisy in lambs at abattoirs doesn't appear to be breed specific, which is very much the opposite of what is reported by people, that it's mainly a British bred sheep disease or lamb disease. So what can we do about it? I'm saying not a great deal in terms of giving you a vaccination, gold bullet, something that's just guaranteed you're not going to see pneumonia or coughing again. There is some work being done and some, I guess, suggestions that we can remove Mycoplasma over pneumonia from the flock through doing testing of all sheep. I'm not aware of any large commercial properties that have done this, and I think it's probably something that in the next few years maybe we'll see some trials that actually show that can be done, and we can put some costs around it and sort of do a bit of a cost-benefit analysis of how successful it's likely to be. One of my big concerns with going down that path is it really is going to restrict your ability to trade sheep in the future, which, for some businesses, trading livestock is a very important part of their profit. But for the closed flock, it could be something, could be a path we go down. But look, my take-home message, and I'll leave myself open here to some good questions, but if we manage the stress in lambs, we actually stop this. And I've worked with clients that have seen this for 2 or 3 years in a row, and then they've actually gotten serious with managing their lambs, and they've had 3 or 4 years without seeing any signs of summer pneumonia in their sheep. So I feel really, really confident that when we keep lambs growing in late spring, early summer, we can pretty well bang the mortality rates on the head. Not convinced that will, well, I still believe that we're still getting pleurisy. I know we're still getting pleurisy in some of those flocks, but I'm not convinced it's causing significant production loss at this stage. So just questions. I see there are some questions. I haven't actually read them, but
I'll just go through them for you. Dusty yards, do they predispose adult sheep to pneumonia?
Yeah, absolutely. We think they do. So it's going to, I guess, have we got really good evidence that dusty yards play a role? Not really, but we do consider the dustier the yards, the higher the risk, as we do hot weather. So it's another potential stress factor for them. But I must admit, the amount of flocks, or merino flocks that have been managed in severe dusty conditions in probably probably northern South Australia and northern New South Wales for a long, long time without any issue does give, I guess, make me think that there's more to the animal and the condition the animal's in than there is to the actual dust itself. Yeah.
All right, thanks, Andrew. What type of antibiotic are most effective against pneumonia, and is only one dose required, or does it require a follow-up?
Yeah, so look, the very best drug is a product called Draxxin. It's probably a drug that not a lot of you may have used. It's a very expensive drug, but it is by far and away the best drug for treating pneumonia. It's a drug that's really commonly used in beef feedlots, and it is a one dose shot. As a vet, I don't like dispensing Draxxin straight off the shelf to clients because it's our drug that we've got up our sleeve in the future when oxytetracycline, which is Alleimycin or Oxytet's the active, starts to break down. So I guess oxytetracycline appears to be very, very effective at treating treating pneumonia, but there is a better drug. But the practice I work in, we dispense Alleimycin or oxytetracycline as our first drug of call for commercial animals, and we like to do that because we like to keep our high-end drugs for down the track when oxytetracycline is no longer working. But there is a better drug out there, but it's about triple the price. So you're $5 a lamb probably instead of being $1.50 an animal. So if I had someone come in with stud white Suffolk rams that had pneumonia, I'd happily go to Draxxin. But my general approach is oxytetracycline. And oxytetracycline, I would normally just do one dose, and anything that still looks sick 3 to 4 days later, I'd give a subsequent one too. But in my experience, one dose really stops the disease in its tracks for at least the next 2 to 3 weeks. Sometimes you see them relapse when the drugs wear off.
There's one around use of MH cattle vaccine.
Yep. So that's a Mannheimia cattle vaccine. We've trialled it, and others have trialled it, and we haven't been able to make it work. We've seen no difference in animals. I know a few people are talking, and some people are using it, and they're claiming success, as in, some farmers are. But we've had a crack at, I think, 4 or 5 different flocks, and we've seen absolutely no benefit. I suspect the people that are using it and claiming it's successful are putting other attention into their animals, which is reducing the stress. And that work has been done by some pharmaceutical companies, and they've found the same response. And normally that's pretty telling if they sort of go down the path and sort of put the white flag up and go, we're not going to be able to sell this product. Then I think that's pretty telling that there's not much of a market for it. And it's not the primary problem, I guess, is the issue. It can be a secondary invader, but it's not the main cause of it's not the main pathogen that causes the pneumonia.
So can pneumonia hit newborn lambs?
Yep.
Is this more a secondary infection to cold conditions, mismothering, ill health?
Yeah, good question. Probably don't really know the full answer, but it's not one of our major killers of newborn of lambs. I guess lambs that are going to be susceptible to pneumonia are lambs that haven't had a drink, and they've been mismothered, and they're going to die well before pneumonia takes a hold of them. So I would think it would be a small percentage of it would kill a small percentage of lambs in, your orphan lambs that have actually had a really poor start to life. They haven't had colostrum, but then have found energy through other milk. But I don't see it as a significant disease in otherwise like lambs that are still on their mother. And there's actually good evidence in that it rarely shows up until after weaning, which, look, again, points to the fact that lambs aren't overly stressed when they've got mum next door to them. will pain relief used in conjunction with antibiotics increase recovery? Look, we don't do it, but that's a really good question. We actually should do it more often. We do it in high value situations. We know that antibiotics penetrate into affected areas a lot better when we use, and it's not actually the pain relief, it's the anti-inflammatory component. So yes, it would aid recovery, but it would massively increase the cost of treatment. It'd more than double the treatment, but high value situations, absolutely, it'd be worth doing. So, right, so arthritis. So 3 main syndromes here as well. So, and I'm going to touch on each of them, but I think erysipelas is the one that we can sort of do the most about. But so erysipelas arthritis, normally, and Mary did touch on this, but normally this is detectable by weaning. So erysipelas is typically picked up in the newborn lamb while we've got the umbilical cord exposed, and it is also picked up at marking time, or animals are exposed to it at marking time. But I consider the newborn lamb to be a greater risk of picking up erysipelas than the marked lamb. That's a photo of it down here in the bottom left-hand corner. You know, your typical terrible arthritic lamb. But for every one of these, I reckon there's at least another one that you'll pick up on abattoir feedback that you didn't know had arthritis. So it's causing more disease than just the little killers that you have at the end of the season. Communal arthritis, I'd be interested to know whether that's something that you guys see much in South Australia. We don't actually see much of it around southwest Victoria, but I do a fair bit of work around the Riverina of New South Wales, and we see a huge amount of it on the back of summer rain up there, and affects significant numbers of otherwise very healthy lambs. And then we've got purulent arthritis, which generally we see that in the 10 days post lamb marking, and you get these small numbers of sheep with really, really nasty, heavily infected joints. So yeah, just to go into each of them a little bit more details, but the erysipelas arthritis, I generally think and we know that it affects sort of 1 to 2% of a flock, and as I said before, you might see 0.5%, but there'll be another 0.5% happening, and often there's another 0.5% that died shortly after lamb marking, or didn't even make lamb marking because they got arthritis. They were so prone to predation, and they die in the paddock. So some are easily detectable, some aren't. Now, I reckon these are our most unprofitable lambs on the farm, because everyone's still got these, as Mary alluded to. Everyone still has these when they sell their last draft of lambs. So they've been there the whole time. We've fed them the whole time, and then we go and sell them at half the carcass weight of other lambs. So I actually think often the best thing to do is we should just be euthanizing these animals when we see them at lamb marking, not keeping them on the farm, because their quality of life's not great when you look at how poor this lamb is in that photo. Now, vaccination with Erivac, in my opinion, is just amazingly rewarding. There's work that's been done that cultures all of these lambs with arthritis, and Erivac is erysipelas is the third most commonly diagnosed pathogen in animals with arthritis. But when we actually use the vaccine, it virtually completely eliminates arthritis from the flock. So what we sort of believe is happening is erysipelas causes the initial infection, and then staphylococcus or streptococcus, other bacteria, come in secondary and cause more damage to the joint. And they're what we culture when we actually get a culture done on these animals. So it's great at cleaning up arthritis. Is it profitable? Depends on many factors. So the first one I think you've got to ask yourself is, well, how many lambs are we seeing? Because obviously that's how many we're going to save, and we can work out our increased revenue from using the vaccine. But the question that I think we don't think about enough is, how many fetuses are we actually marking per ewe? And I say this because if you've got a merino flock that's focusing on wool, and you're just driving stocking rate, and repro's not part of your real profit driver, then it's going to be really, really hard to justify using Erivac. And Whereas if you've got composite flock, first cross flock, where you're marking 140% lambs every year, there's going to be a lot greater value in using it. And the reason for that is that we vaccinate the ewe. So the ewe gets the shot, and if she's going to mark us 1.4 lambs, for every time we vaccinate, we're actually protecting 1.4. So in a, your fine merino flock of low repro chasing traits versus your high repro prime lamb flock, you're probably going to be vaccinating twice as many lambs with the one dose into the ewe. And I just think that's something to think about. The other big one is the lamb value. So again, if we're selling $250 lambs versus selling, I was going to say $80 store lambs, but they haven't been around for a while, $130 store lambs, there's obviously a significant difference in what we get for those. And as I said before, the level of incidence. So I think you've got to do a bit of your own work on how many is affecting, what's the cost to do the flock, and how many lambs are we protecting before you can actually decide whether it's definitely for you. But in general, for most flocks, it will pay for itself, but it's not going to leave this wonderful bonus in your bank balance at the end of the year. I think it's a wonderful welfare tool, and I generally recommend Aerivac to be used in flocks. But I think you've got to look at your own situation before committing to it. So communal arthritis, I touched on this. When we see it, so it nearly always occurs after a summer or late spring rain event, and that's chlamydia lives in the soil, and the rain actually sort of makes it more available. We think it actually sort of activates it and makes it available for lambs to absorb it, and then for it to be to penetrate into their joints. So when we get these rain events, we can see 20 to 30% of a mob in the worst case, but typically 10 to 15% of lambs that have been doing really, really well, like your lamb feedlots is a typical situation, probably because they're on a lot of dry feed and they're more likely to be exposed to it, and because there's been so many lambs in that area for the last 2, 3, 4, 5 years in the feedlot, there's a much greater build-up of chlamydia. So that's when we seem to see it at its worst. So how does it present? Sudden onset, you get a lot of heat and only minor swelling really in the joints, but the lambs are really hot-footed. They're almost a bit like your laminitic horse. They're sore in all joints. When you actually exercise them, they can move quite well, but they look really, really tender. So the same drug as before, oxytetracycline is our drug of choice, and animals do respond really, really well to that, provided we treat them early. If we don't treat them early, you will get significant change, and arthritis will be picked up on. And what happens there is your abattoir chops it off, not at the arthritis, but they go up a joint, so you lose a significant part of the carcass. So as I said, antibiotic therapy is rewarding, but continually using it is of some concern. And we've actually we've got some clients that use this. We've used some oral antibiotics in high risk situations, and it works wonderfully well. But it's not the path we want to go down of having medicated feed for animals. And the other one is our post-marking Mulesing arthritis. I'm not going to spend much time on this because it's not really a big problem in most flocks. And if it is, it's really pointing to your hygiene marking. But it presents 10 to 14 days after marking. We culture all sorts of bacteria. The joints, as you can see in that photo, the joints are massive and they're just full of pus. If you can treat them early, they do respond. But if you're 4 or 5 days late, the aggressive nature of the lesion means you get such significant arthritis. So euthanasia is often the best way forward with these guys. And I guess one of the reasons for that is that yarding a whole mob of lambs that were mulesed 10 days ago to treat 2 or 3% with these lesions is actually going to cause more of a problem, production loss to the other lambs, because you're going to set back all of your healing of your mulesing wounds. I think that's a case by case scenario. So arthritis. My take-home message is, if you're seeing issues that sound like erysipelas, start vaccination if you think you can make it work. practice good hygiene at marking and any time we cause a wound in sheep. And the reason I say that is one of the other places which I haven't really touched on, but for our merino flocks with considerable wrinkles, getting a lot of cuts in our sheep at shearing time, particularly at that first shearing, is another great opportunity for them to pick up bacteria that can cause arthritis. So it's no different to mulesing in terms of how much skin can be taken off these sheep sometimes. So just keep that in mind. Try and be hygienic. And marking portable yards on grass rather than your permanent yards that are dirty. Get tail length right. Now this is actually, I should have put this in the talk about pneumonia, because one of the secondary problems with pneumonia is the sheep cough a lot and we get a lot of rectal prolapses. When we get the tail length right down to the tip of the vulva, we virtually stop those rectal prolapses. But it's also a short tail is more likely to cause arthritis in sheep. So there's two reasons there for you to get the tail length right. Get lambs out of the yards as soon as possible, and as I said, practice good hygiene at marking, clean and sharp tools. Back to question time.
All right, thanks, Andrew. A couple of questions regards Aerovac. So is there any point only injecting maiden ewes with Aerovac and not older ewes?
I don't think so. I think to get a good immune response in the sheep, and there's great evidence for this with all of our vaccinations, if we don't do the ewe in the 3 to 6 weeks prior to lambing, we don't get a great immune response. So therefore the lamb isn't protected, and we're trying to get maximum protection into the lamb. So I think it's important to do your double shot in your maidens and then a single shot as a booster pre-lambing. If you're gonna use it, I'd commit to doing it properly.
Right, so that probably answers this next one. If you choose to start vaccinating Aerovac, ewes need 4-week booster the first year.
Correct. Yep, that's right. So look, first one at scanning, second time a month later is a pretty routine program that I'd recommend. And look, Mary might like me saying this. There's a bit of a push. People promoting using Aerovac, which I think might be this next question. Aerovac at lamb marking for lambs. I'm not a fan of it. We need it on board for the lamb when it's born, and we want it protected at marking. If we give them a dose at marking, they've missed the opportunity at birth when they were most likely to get it, and it's not in full efficacy at marking. So put the lamb marking one away and do the maidens twice as maidens, and do your mature ewes once pre-lambing, and then your replacement ewes, they get done the first time when they're scanned pregnant.
Okay, thanks, Andrew. If anyone's got any more questions, please feel free to email them through to us. Given the time, we might call it a close. But yeah, I'd just like to thank Andrew and Mary again for their time and their insight and expertise in these areas. So thanks very much, guys. And I thank everyone for joining us tonight for the webinar. Thank you for your time and have a wonderful evening. Good night.